Okay, welcome to chapter 16 of Intro to Psychology. In this video, we'll be talking about therapy and treatment. I'm going to begin by showing a case study. I'm going to read this out. This is a case study of an individual seeking treatment, and let's try to figure out together if this person has some kind of psychological disorder. So Danielle is an 18-year-old Wayne State University student who recently moved to Detroit from a small town in Illinois. Danielle's soccer coach referred her to the Wayne State University Counseling and Psychological Services because he was concerned with her behavior over the past month. Danielle met with a therapist at CAPS for an interview. When asked about what may be bothering her, she stated that she just can't seem to shake a dark cloud hanging over her. She described feeling negative about herself and feeling persistently sad for about a month. She stated that she doesn't enjoy playing soccer as much as she used to, and that she feels like she doesn't fit in with the other girls on her team. Danielle described having problems making new friends at Wayne State. She was a straight A student and a star soccer player at her high school, and repeatedly made the honor roll and was named to the All-Star soccer team for her school district. At university, however, Danielle has found classes to be much more difficult. Although she studied incessantly, she was struggling to pass a biology class, which was her best subject in high school, and she hadn't missed a single soccer practice, but still wasn't getting much playing time. In his referral, Danielle's soccer coach noted that she seemed to be doing everything slowly, even off the pitch. She would answer questions slowly and was often the last to leave practice. He noted that it seemed like she was being weighed down by something. The therapist asked Danielle to describe a typical day. Danielle explained that she often feels lethargic in the morning and has difficulty getting out of bed. She described having trouble concentrating during her classes and that she often feels stressed about going to soccer practice. I try to get enough energy to go to practice, but my heart isn't always in it, she said. I just feel like, what's the point? I'm not as good as the other girls on the team, and I'll never get to play as much as I did back home. Have you thought about getting a tutor to help you with biology? Asked the therapist. No, Danielle replied. It's just no use. I'm no good at anything. I'm a total loser. What about friends? Asked the therapist. Have you tried to make friends with the other girls on your team? Danielle answered, At first I did, but I could tell that they didn't like me. They already have their own friends. Who wants to be friends with the new kid? Things would probably be better off if I wasn't even here. So, according to this little vignette that we just read, uh, the first question that we'd like to ask is, does Danielle have a psychological disorder? So thinking back to what we described in the chapter 15 videos, when we think about psychological disorders, we're looking for these three characteristics. Is there evidence of personal distress? Is there evidence that some social norm has been violated? And is there evidence of disability and dysfunction? So let's take a look at her story. Those of you who are here in attendance, you can reply in the chat. Would we say that there is evidence of personal distress in Danielle's story? Feel free to pause the video here and look for evidence. So it may seem like an easy answer. I would probably say yes, that there might be enough evidence in this case to say that, yeah, there's evidence of personal distress. She reported that she often feels stressed about going to soccer practice. So that subjective experience of feeling stressed would probably be enough evidence for us to say, yeah, she's reporting that this is distressing to her, that the behaviors she's experiencing are distressing to her consciously. Next, a violation of social norms. It seems like that may be the case, particularly because someone else made the referral. Someone else noticed a change in her behavior that was out of the ordinary, that was perhaps a violation of how other people on the team behave. So we might call that a violation of social norms, particularly regarding the mention of her soccer coach. And then lastly, disability and dysfunction. When we look at that, we see that Danielle is suffering with dysfunction in certain areas. So as was noted in the first page, that she's having difficulty with things at school, that her grades are that she's struggling with those things, and that it's also maybe affecting her on the soccer pitch. And so, in many ways, she's experiencing dysfunction in multiple areas of her life due to perhaps some underlying thing going on psychologically. We can also think about this in terms of the spectrum or the continuum between mental health and mental illness. She's clearly having some emotional problems or concerns, and it's up to us to really think about, does this really fit a diagnosable mental disorder, or is this just regular life stress or regular life adjustment issues? Uh, or I shouldn't show that first. What would you guys say, those of you guys who are here, any guesses as to which psychological disorder might be implicated in Danielle's case? That's a great guess. Yeah, I would agree with that, that it might be the case that Danielle is suffering from depression. That particularly what the coach noted about, like she was acting differently, like she was acting slow, and her report of just kind of giving up and feeling like, man, I wish I wasn't even here. That those would definitely hit a clinician's ear and be signs and symptoms of depression. Now, there are many subtypes of depression to be aware of, and kind of in a cascade of how severe they are. One, there's is something related to just feeling depressed, just having temporary feelings of sadness. Without meeting the criteria for major depressive disorder. There's also seasonal depression, where people experience symptoms related to feeling sad or and having a lack of interest in doing things at certain times of the year, particularly during the winter. Then there's major depressive disorder, which we'll describe in more detail in a moment, as well as other forms such as postpartum depression, depressive episode after pregnancy, and then dysthymia, which is depressive episodes that go on for an extended amount of time for at least 2 years. In this case, it looks like what is most likely the case is that Danielle could be categorized as suffering from major depressive disorder. We took a look at the criteria last week, and we see here that she meets at least five of the following symptoms. So she reported that she's been experiencing problems for about a month, and she reported experiencing a depressed mood, anhedonia, which is a diminished interest in formerly pleasurable activities, psychomotor retardation, that she was thinking and walk and acting slowly, as well as feelings of worthlessness, as well as a diminished ability to think or concentrate. And B, that these symptoms were resulting in significant distress and impairment in social and academic areas. And so a clinician looking at this case might think of major depressive disorder as a possible diagnosis for Danielle. Now, in order to make that diagnosis, a clinician such as myself, if I was operating in this case, I would take the interview. I would also look for some collateral information from people who know her well. I would also probably administer some personality scales, some self-report measures of mental health and personality to see if that's exactly the case, or if there's some other better explanation for her difficulties. So in the next video, we're going to talk about different types of treatment for depression. And we'll use depression as kind of the thread linking the different topics that we'll be talking about this week.